Just across the border in Maryland, you can make an appointment with a nurse practitioner who can diagnose what's wrong with you and prescribe your medication without a doctor's supervision. Not so here in Pennsylvania, and some want that to change. Seth Kaplan joining us now live in studio with this story. Seth.
Valerie, nurse practitioners in Pennsylvania want what's called full practice authority. What is that? Well, let's start the story with someone who doesn't have any authority yet.
I want to be a peds trauma surgeon.
A pediatric trauma surgeon someday. Right now, Giovanna Lundy is a 10-year-old fifth grader, and her mom, Nicole?
She's a nurse practitioner. She helps people, and she gives them medicine.
But not independently.
We have to have a signed, written, collaborative agreement with at least 2 physicians on file in Harrisburg.
The impact of that, according to folks at this event like Janice Miller, a nurse practitioner and president-elect of the association that represents PANPs.
This prevents a lot of nurse practitioners from being able to see patients in rural communities where doctors have retired or doctors are leaving, and there is no health care left for the residents and the community. And in Pennsylvania, we're losing nurse practitioners all the time because we are surrounded by states who have full practice authority. In Maryland, in Delaware, in New York.
3 states among the 27 that already allow NPs to practice independently. Could Pennsylvania become number 28? That'll depend on whether this bill, which would allow PANPs to diagnose, treat, and prescribe medication without a doctor's supervision, becomes law. Doctors bill for that supervision, a cost and complexity NPs say prevents Pennsylvanians from getting basic medical help. Doctors disagree.
While we appreciate, all of the work that everyone does, I think we do have the expertise to provide care and to direct the team in the right direction for patients in Pennsylvania.
Dr. Kristen Sandell, president of the Pennsylvania Medical Society, says doctors have more than 12,000 hours of clinical education before they practice independently, whereas NPs would have less than 1,000. Their response?
Nurse practitioners are trained and all the focus of their clinical education is for that specific population. So I never spent 6 months in a surgery rotation I'm never going to use as a primary care nurse practitioner.
We showed you the Senate bill. There's one in the House too. Bipartisan support in both chambers, but as you saw, opposition also an important issue, Valerie, and one we will continue to follow.
I know you will. Thank you, Seth.